Hello there, welcome back to my channel. This is Dr. Chen from All Things Test. In today's video, I'm going to share with you some misconceptions of standardized examinations. No matter if you want to become a physician, a lawyer, accountant, or any other young professions, I think you will benefit from this video. Once you have a good idea of how exam works, you can be more focused on the real study of the exam rather than feeling anxious all the time. I made a free ebook of this video and put the link to download in the description box. Okay, let's get started. Misconception number 1. Exam questions were written by employees of testing agencies. It is very common to have the impression that testing agencies must have their own employees work for them full-time and write in exam questions because standardized tests are the intellectual properties of testing agencies. However, the reality is, testing agencies such as MBE, NCBE, AICPA are the authoritative figures in the profession, so they have the power to call volunteers to work for them. The volunteers are usually the professors at universities or experts in practice. It is actually a win-win situation. For the testing agencies, they can select the best from the best to work for them and write high-quality exam questions. For professors or experts, writing exam questions is a way contributing to the educational community of the profession because volunteering for testing agencies is a highly selective process. Professors and experts feel honored of being a question writers or examiners. Also, writing exam questions is a very complicated process done by a group of different content experts. Now, I'm showing you a list of content experts working for AICPA on practice analysis or job analysis. The purpose of a job analysis is to determine what knowledge or skill sets should be tested on a standardized examination. As you can see here, the list is consisted of about 200 content experts from universities, private sectors, government, and other organizations. And this is just a fractional number of content experts working for them. Testing agencies usually have different committees working on different tasks. Now, I'm showing you a list of exam committees of MBE, and this list is about 50 pages. In conclusion, if you know how the exam or the question is created, you will understand that you will very likely to use the knowledge on the test in your future professional lives. And this will help you internalize the value of exams and be more focused on the study. Misconception number 2. Standardized examination is all about memorization. I think it is very common to have that perception because that is what final exams are about. The finals at your medical school, law school, or accounting school is created by professors who are not familiar with how to build a high-quality examination. Testing agencies usually have a large group of content experts. They won't waste their time writing just memorization questions. Also, testing agencies are fully aware that testing memorization is not the best way to measure knowledge acquisition. Instead, licensure and certification exams aim at measuring the application of knowledge on the majority of questions. Now, I am showing you a couple of practice questions of USMLE Step 1, and practice questions are retired questions from previous exams. So these questions assembles the question on the real exam. And as you can see here, none of the questions ask for memorization of certain disease or disorder. Instead, it gives you a clinical scenario and asks you possible diagnosis. This question is also giving you a scenario and asks you for proper response to demonstrate your communication and interpersonal skills. As you can see here, none of these questions testing memorizations. It is more about diagnosis, application of knowledge, and communication skills. There is no way you can memorize the proper response from any test prep materials. Now, I am showing you a couple of questions of MBE. As you can see here, none of the questions ask for specific laws or regulations. Instead, they ask for application of knowledge and your judgment of certain scenario. In fact, some of the exams have their own assessment framework. In this screenshot, I'm showing you the USMLE Step 1 competency model. As you can see here, there are 4 levels of assessment. About 70% of questions is about application of medical knowledge, and about 25% of questions are about diagnosis and patient care. And this is a screenshot of the CPA exams using the Bloom's taxonomy. As you can see here, the majority of exam questions are about application, analysis, and evaluation rather than memorizations. Now we know that licensure and certification exams test the application of knowledge. Instead of focusing on just the memorize of facts and knowledge, next time when you prepare for those exams, you can put more emphasis on the application of knowledge. And maybe imagine how you would handle those situations in the real world scenario. Number 3, misconceptions about multiple choice questions, MCQ. I actually have a lot to say about MCQs, but for the sake of this video, I will just talk about the top 4 misconceptions of MCQ. If you're interested in that topic, leave me a comment or give a like, and I will do a video on that topic next time. The top 1 misconception of MCQ would be there is partial credit. You probably think that if you choose an answer that is close to the correct answer, you will get some credit for that. However, the reality is you only get credit when you choose the correct answer. Now, I'm showing you how MCQs are scored in the real world with a simulated data set from the RCT package. As you can see here, you only get a score when answering the question correctly. Otherwise, it is considered as incorrect or score 0. If you skip a question, it is a 0 as well. So next time, when you are not 100% sure what the correct answer would be, don't waste your time overthinking. Just choose an answer with your first hunch. Number 2, choosing C for guessing. I know we all heard from a friend that if you don't know the answer, just choose C and you'll be fine. After working in a testing agency, I realized how naive our thoughts were. Now I'm showing you a practice question of USMLE Step 1. As you can see here, they ordered the options alphabetically from A to Z. Again, when you need to guess for an answer, go with your first hunch, and maybe that is the correct answer. There is no magic C in MCQs. Number 3, it is easy to cheat on MCQ test. I think this is kind of related to what I just talked about, the order of options. With testing agencies changing from paper pencil test to computer-based test, it is very easy to randomize the order of questions and the order of options. The first question on your test might be the last one on my test. For the same question, the correct answer might appear as the first option on your test, but last on my test. In reality, it is very difficult to cheat on MCQ tests or even talk about it after the test. So just be honest to yourself and remember that what happens in the testing center stays in the testing center. Number 4, more options means more difficult. I think this is more applicable to medical school students because MBE uses a mix of 3, 4, and 5 option MCQs on their exams. Intuitively, we thought a question with more options should be more difficult because of more distractors. While if you know the correct answer, it doesn't matter how many distractors you have. If you are not sure or if you don't know the answer, the probability of guessing the correct option is 1/5 for a 5-option question. The probability is 1/3 for 3-option questions. It's actually not much difference on a scale of the whole test. So next time, don't feel intimidated by a 5-option MCQs on a test. If you don't know the correct answer, just go with your first hunch. Well, that's all about today. Thank you for watching. If you enjoyed this video, please give a like or subscribe, and I will see you in the next one.